morning, everybody. So good to see you all today.
Good morning. Love the ASL interpreter in the room. Thank you.
Absolutely. I'm gonna give it just a couple more minutes to get started today. Lindsay is actually going to be out today. She messaged me this morning saying that she got some sort of virus. So we're just gonna give her the day off to rest and recover. So that section of the agenda, we're gonna push until our next meeting, but we do have somebody to come speak to us about rule updates today. Meredith is actually going to be helping us today. Hi, Meredith. Good to see you on. I just wanted to let you know. Give it just a minute. Let some more people join. Then I can go ahead and start sharing my screen.
Caitlin, I'm going to stay off camera today. Whatever virus is going around is definitely trying to take me over. So I'm going to just drink some tea and stay off camera.
Absolutely, not a problem. Thanks for even joining us today, Megan. Absolutely. It's completely fine for members of the public to join. We're glad to have you today. All right, everybody. Let's see here. Give it another minute and then we can just go ahead and get started for the day. Should be a little bit of a shorter meeting today. Give you all back some of your Thursday afternoon. So, well, with that, we can go ahead and get our day started. So, good morning, everybody. Welcome. So glad to see you all. Haven't seen you since November of 2024. So I hope you all had a wonderful holiday season and are nice and relaxed and rested and ready for the new year. So with that, we can go ahead, scroll down and start our roll call today. So it looks like we have a new member joining us today, Lindsay Gaffey. Lindsay, would you like to come off mute and introduce yourself?
Yes. Hi, everyone. I'm Lindsay Gaffey. I am Vice President of Patient Care Services at Children's Hospital Colorado in our Pediatric Mental Health Institute. And I am really excited to join this group and excited to meet you all and move this important work forward. Thank you.
Thank you, Lindsay. It's great having you. Who would like to go next?
I'm happy to pop in next. This is Deborah Monahan, and I work at the Colorado Department of Human Services. And I'm having a little issue with my Zoom account this morning, so I'm going to try to get my camera working. But it's nice to see everyone today.
Thank you, Deborah. Not a problem. Technology is great when it works.
Very true.
I'll jump in. My name is Brett Snyder, and I'm with Signal, one of the administrative service organizations that helps to administer CYMHTA for a couple of the regions in the state. And also we do a lot of other stuff, but most related to this conversation. That's our role. Nice to see everyone today.
Brett.
Hi,
I
it's
can
me,
go
Lovelace.
next. Oh, go ahead, Megan.
Sorry. You can go, Dr. Klatt.
No, you're fine. Go, go, go.
Okay, hi, I'm Megan Lovelace. I'm the Mental Health Policy Coordinator for Colorado Cross Disability Coalition. And the seat I represent is parent of a super awesome child. I'll pass it to Dr. Klatt.
Hello, my name is Anastasia Klott. I am a child psychiatrist. Clinically, I work on the consult team and in the emergency department at Children's Hospital Colorado. And in this space, I'm representing our child psychiatrist organization for Colorado Child and Adolescent Psychiatric Society.
Is a mouthful. My name is Gina Robinson. I'm with Healthcare Policy and Financing, where I'm a senior policy advisor.
Sarah Fielsticker, I'm an attorney at Disability Law Colorado. My seat is representing individuals with intellectual and developmental disabilities.
Hi everyone, my name's Brett Bayman. I am with Pitkin County DHS. I'm representing child welfare staff seat, I'm pretty sure.
Anybody who hasn't gone.
Hey everyone, I'm Rochelle Gailey. I'm with the Behavioral Health Administration Licensing and Designation Team. Although I'm currently the grievance officer, I previously was the licensing manager for adolescent treatment services, so I'm just filling in until that role is filled.
Thank you, Rochelle. Great. And for those of you who have not met me yet, my name is Caitlin Long. I'm the Boards and Commissions Coordinator for BHA, and I help to oversee all of our internal statutorily required councils, our external statutorily required councils, and I'm helping with the support of getting our BOSO regional councils up and running. So great to see you all today. All right, so I believe I have everybody marked as present who is present, but please take a look. Let me know if I messed up. It is early and I'm on my first cup of coffee. So I think we might be good to go. And with that, just wanted to take a moment to see if anybody had anything to add to the agenda for the day, for our agenda review. I should have received this last week, but here, let me go ahead and drop it again in the chat for you all, just in case. Anything to add, subtract? Again, we will be moving Lindsay Edwards' section regarding the 24 annual report, as well as the rural care access update to our next meeting because she is out sick today.
The agenda looks good from my end.
Thank you, Anastasia. Do you have anybody to second that?
Second.
Thank you, Megan. All right, so we're going to confirm the agenda for today. And next we will move on to our November meeting minutes. We'll go ahead and drop this in the chat for you all as well. Let's look over.
Motion to approve the November meeting minutes.
Thank you.
I'll second.
Who's the second?
Sarah.
Sarah? Thank you, Sarah. Right. Well, with that, we will go ahead and get into our board business and BAJ updates today. So I wanted to review our second draft of bylaws and go ahead and possibly get those confirmed and voted on today. So as you all have seen, we've been working through our bylaws for the last couple of meetings now. I'm going to go ahead and drop that link in the chat here as well. So we've walked through our mission and our vision statement. We've gone through Article 1 as well as Article 2. This is the one section that we kind of keep coming back to, and this is with regards to the officer tenure. So when we first originally helped to quote unquote standardize the bylaws, and I use that term loosely because as you all know, we've kind of worked through all of our internal statutorily required councils to help them standardize bylaws, just to, kind of lay out statutory requirements, membership requirements, seat requirements, and things like that. And then we've tailored each of these bylaws to the needs to fit the needs of each council individually. So we've kind of gone through that, and now we're at this point of the officer tenure. So we had originally wrote it that the officers will hold a term for 2 years. However, Lindsay Edward had brought up a comment stating that it might be better to have longer terms for officers, so that way we can kind of create a bridge when we bring on new people. So we'll have kind of like our onboarding officer, our acting officers, and then our exiting officers. So that way we kind of have like that historical knowledge transition as we begin onboarding new leaders. Wanted to kind of bring this up for discussion today, see what your all's thoughts are, see if, if writing that in these bylaws, how we write these in the bylaws, if you think that that would be beneficial, if you think that that might be, kind of daunting to be able to have to take on a task for such an extended period of time. So really just want to kind of bring this up and discuss this with you all today. So I know in the email that we had sent out last week, we had asked you all to look at this section specifically and kind of come prepared to make some comments and notes. So wanted to see what your feedback was today.
This is Gina. I'm already down there as agreeing. I think it's a great idea.
Gina, exactly for which section? Did you want to, were we talking about, the 2 year? Did we want to write it for a position of 4 years? What were you
agreeing with Caitlin's suggestion of the longer terms or the onboarding and offboarding? I think that's a great idea.
Okay. And then as far as how long the term limit should be, what are your recommendations with that? Anastasia?
So I think to help with transition, it would make sense to kind of have a time period prior to being an officer, the time where you are an officer, and then the time after that. If we make it all the same chunk of time, then 2 years of an officer time could potentially then actually span out to 6 years. Another thought would be having the time you serve as an officer being 1 year with 1 pre-year and 1 post-year to help with on and off boarding in that position.
Yeah. So write it as 1 year of basically, supervising or like training and kind of learning the role. And then 1 year as acting officer.
Right. Like in our CCAPS organization, we have you're the president-elect for 1 year, and then you're the president, and then you're the past president, each for 1 year.
You said president-elect, acting president, and then what was the last one? I like those terms.
Past president.
Past president. Okay.
I like that suggestion as well, Anastasia. I think it maybe, I don't know, just thinking about trying to strike a balance between length of time that someone would be involved as an officer and some of the, additional responsibilities coming with that, to not have that be, become like kind of too lengthy that folks may not feel that they're able to kind of commit to that because they want to, be sure that they're able to do that job well. But also having that balance of not having too much transition happening too quickly where the kind of institutional knowledge piece is lost. So I don't know, thinking of it as like a 3-year chunk overall with a 1-year piece of increased kind of responsibility feels like a good balance.
Yeah. And do you think it would be beneficial to kind of break down, the roles of president or like officer-elect versus acting officers versus past officers?
It made sense in my mind when I heard Anastasia describe it, where it, those titles seemed helpful. So I don't know if I'm conceptualizing it the same way, but what I was hearing was that there would be like council chair-elect, council chair, outgoing council chair, whatever the term was for that one. I think I missed that. And then the same for vice chair would be like a vice chair-elect, current vice chair, outgoing vice chair.
Yes. And then what do we see as like their responsibilities? So we have the responsibilities for the acting officers broken down, but what do we see as the responsibilities, obviously for, the presidential or the officer elect, we'll have them, kind of shadow and learn and things like that. And then for the outgoing officer, supporting and being that source of historical knowledge. Do we think that it would be beneficial to have them, at all of the executive subcommittees as well? Do we think that, the outgoing officers should be just as active as the elect and the active officers? Just want to make sure that we're like really breaking down like roles and responsibilities. So when we start getting new officers and things like that, we can make sure that everybody is kind of like on the same page on what their duties are at that point in time within their officer term. Lindsay?
I wanted to ask if we stagger the council chair and the vice chair. And in addition to what Anastasia shared, I'm used to that, the structure that we're talking about, and I'm used to staggering so they're not moving at exactly the same time. Is that already in place or something we might consider?
Sorry, Lindsay, I'm sorry, I'm trying to do so many things at once right now.
Yeah.
Could you repeat that? My apologies.
No worries. I was curious if currently the council chair and the vice chair are on the same time period of when they are serving versus when they are transitioning, or is it staggered?
So we actually don't have a chair and vice chair yet. We are going to be electing those today. So this is all very new for this council. And so right now we're going to be, just having our first officers come in. So we're not going to have any sort of like that transition period. But, as we get our bylaws finalized, that's kind of what we're wanting to define. So that way, the new officers that we're going to be electing today can be this acting officer right now, and then maybe in like a year or two we begin the new officer onboarding and have them start the transition out process.
Okay, great, thank you.
Absolutely. Megan?
I had a similar question to Lindsay. And you guys, I'm also on BPAC. And I'll tell you that we do have it staggered there, just because we want to make sure that people feel prepared and ready to do that role. I would say that with the pre and post presidents, that we don't want that to feel too overwhelming also, right? Like if you are committing to a term, onboarding should be simple and easy to manage with your schedule, as well as outboarding. Just as an example, in BPAC, we just really kind of support each other in the roles as they come up. And we have a pretty good flow. So there's never a time, I don't think, when anyone doesn't feel supported in their leadership role. So just letting y'all know, as complicated or as little complicated as we make it. I think we're a small enough group, we can all support each other in whatever roles we play.
And yes, and we're always going to be here to support you as well. You know, we're this is a new step in this council, and you know, still new steps in some of our other councils as well. We hadn't had some officers in previous councils, so we're really trying to, you know, learn and grow alongside of you all. So I developed some officer training that I'm sharing with the officers, and you know, we'll schedule some check-in meetings between officers and the BHA to offer that extra level of support. So, you know, as we do elections today, based on the nominations that you all have already previously sent, and then, you know, in the future when we start nominating new officers and things like that, we really just kind of, as Megan said, want to reiterate that we're here to support you and learn alongside of you. So if anything needs to like change in the future, or you know, we look at bylaws next year and say, hey, this really isn't fitting anymore, we absolutely can go back and adjust as needed for the needs of this council. Brett?
Yeah, I was thinking to your question, Caitlin, of like what are the responsibilities of folks at different phases in this chair kind of setup. And I guess the way I was thinking of it originally, with the suggestion of, you know, an elect year, a serving year, and an outgoing year, that was for the chair and then also for the vice chair, that would mean that there's 6 people involved at any one time. And thinking about the size of this committee,
yeah,
that feels maybe a little unwieldy to operationalize in terms of it being an executive subcommittee and a chair, the chairs to help shepherd things through and not have to have the whole council, you know, involved in all those operations. And so I'm wondering, like, some of the way that I think it was phrased in your comment on the document, Caitlin, was instead of conceptualizing it as like those are 2 separate pathways that folks are, which would result in 6 people, is the vice chair basically being the elect. And so there's like a vice chair, a chair, and then an outgoing chair. And then the next year, that vice chair has become the chair has become the outgoing chair, and there's been an election for the new vice chair. And then you have 3 people that are in some phase and interacting with and that to me feels a lot more manageable to have then all of those roles involved in the executive subcommittee, so that both the institutional kind of like warm handoff and knowledge could happen, as well as the onboarding piece could happen in a way that feels a little bit more nimble than if it was involving a much larger group.
That makes a lot of sense. Deborah?
Yeah, I think that is a really good idea, Brett. I like that, because I was also thinking like 6 people out of this group is a lot at any one moment. And at the same time, I think that the time frame could be a challenge, just realizing how people go in and out of different roles, and that these board seats are connected often to particular roles. I worry if we make the commitment, you know, too long. 2 years to me seems probably ideal, although it sounds like maybe 3 would make sense if you're vice president and then for a year and then president for a year and then outgoing for a year. I think that could work. To me, that seems like the upper end of what might be manageable from a commitment standpoint to ask for someone from that standpoint. So those are my thoughts. I love that idea though of a kind of a single track rather than 2 separate and parallel tracks.
Definitely. I think that makes the most sense for this council, definitely. Perfect. Well, I want to be mindful of our time. So if it's agreeable, what I'll do is I'll kind of go back in and write that, the vice chair will act as like that president-elect, the chair will act as the acting president or the acting officer, and then we'll have that past president to kind of support that single train of officer appointment. And then we'll kind of break down some of their roles and responsibilities. Mostly, the vice chair is learning the duties and supporting the chair being the active officer, and then the exiting officer or the past president as just kind of like that support network that might not have as much as the duties of the vice chair and chair, but are going to be there to kind of offer that administrative support and help and educate as needed. All right. So with that, let's jump back over. Do we want to go ahead and vote, or would we like to see kind of the written format of the officer tenure, and then we could possibly even do an e-vote? What are your all's thoughts about that?
I'm fine with kind of seeing it written out and then doing an e-vote.
An e-vote?
Second that.
Thank you, Brett. All right. So we'll do an e-vote. So I will be sending out in my follow-up email a copy of the final draft of bylaws as well as a form for you all to be able to go in and submit your vote. It will be extremely simple. It will say, yes, I approve, no, I disapprove, or I abstain from voting. You'll select one and then we'll cast that, and then we'll get the chair and vice chair to sign, and then we'll have those uploaded to our public facing website. So yay! Exciting. All right. So moving on to our council officer vote. So as you all know, you had submitted nominations for council officer again in 2024. So today we were trying to hold the officer vote in November, but we didn't reach a quorum at the November meeting, and so we postponed until today. But your nominations for officers for chair was Anastasia Klatt, and then for vice chair was Brett Snyder. So today we're going to put those nominations forward and just hold a formal vote to have Anastasia and Brett formally elected as the officers of the council. So if I could get a virtual hand raised for Anastasia to serve as the chair for, see, 1, 2, 3, 4 virtual hands. Sarah, thank you. Thank you, Brett. Thank you, Brett. All right. So Anastasia has been passed. Congratulations, Anastasia. All right. And then what about for Brett for vice chair? Bring them back up. I see. All right. 1, 2. Thank you. All right. Perfect. Well, we have officially elected officers for CYMHTA. So welcome. Thank you all so much. We're so excited to start working with you, Anastasia and Brett. I know you're going to be fantastic leaders. And yes, we'll just continue to kind of work together to help you with this onboarding process. Instead of, me talking a lot during meetings now, you're going to hear a lot more from Anastasia and Brett. So that's very exciting. And so looking forward to working with you all. And I know this is just going to be a wonderful process and partnership. All right. So moving forward, talking about commissioner updates. So I just wanted to briefly let you all know that I am working with Johanna Baca I forget her exact formal title, but she's basically the commissioner's right-hand woman. So I'm working with her to start creating a monthly update from the commissioner that's going to be going out to all of our internal statutorily required councils. So it's going to be providing some high-level updates with regards to, leadership within BHA, what's going on within BHA, what's going on statewide, federal updates from all the uncertainty happening right now. So it's going to be about 1 to 2 pages of these just high-level updates directly from the commissioner that I'm going to be helping Yo and to produce. So those are going to start coming out in March. So you'll be getting a monthly email from me with these commissioner updates. If you have any specific questions that you would like to be addressed within these updates, please just go ahead and email me and let me know so we can add that to our monthly update, kind of calendar. So this is going to be another way just to kind of get some direct feedback from the commissioner herself. So again, if you have any questions that you would like the commissioner to specifically answer within these monthly updates, definitely let me know. Otherwise, you're just going to be receiving a monthly email from me with these updates from the commissioner. Any questions?
Caitlin, this is Megan. So there's no update today.
No update today. No, those will be starting in, I believe the first one's going to be coming out in the middle of March. So we're working on formalizing everything right now. And then Yo has a trip planned. So she's going to be out for a little bit. Which I'm so thankful and jealous for her. But so once she gets back, we'll be able to get those out. So we don't have any updates right now, but I just wanted to let you know that they are coming down the pipeline. And to utilize me as, kind of a sounding board for any questions that you might have, so I can bring that up to get it answered by the commissioner and leadership themselves. So any other questions? All right, and so with that, I'm going to pass it over to Megan Lovelace to talk about some of the recruitment activities that we're going to be working through. And I'm going to be showing a list of the seat vacancies that we have as we start looking through our recruitment process. So Megan, do you want to take it over?
Sure. Will you drive slides or drive the visuals, please, Caitlin?
Yeah, I'm going to pull those up. Give me 1 second.
And please excuse me, y'all. I feel a bit like the lion in Madagascar after they hit him with the trank gun. So if I don't make any sense right now, I did take some cold medicine. So for our recruitment process, we have several steps in place to make sure that we're really reaching out into all the spaces in Colorado to assure that we're getting the appropriate representation across the board for our decision-making process in this council. So what we will do is we will have an outline of what it is that we're looking for in membership, and we'll be sending that out. We'll have a little packet that we'll be preparing for you all. And in that packet, it will be an invitation to apply to this council. It will talk a little bit about what CYMHTA is, what the Mental Health Treatment Act is, right? It will kind of give the background of our council. It will talk about what seats we have vacancies for, and it will invite folks to apply. And so this will be a tool that all of us on the council can use to spread across our networks so that we truly are capturing the appropriate representation in this group, right? We have a big task before us. We have a lot of responsibility. And so stewarding that responsibility appropriately means making sure that we do have voices across the board for representation. So our recruitment process is beginning, and that's that email that I was referring to. We'll also bring that out across our social media channels through BHA. We, of course, encourage you with the materials that we will provide to you to reach out on your channels as well. And in March and April, we're going to just begin kind of that process, right? So the application's open, and this is where we really want to push it and say, hey, don't forget to apply. We're going to make sure that the application process is fully accessible, so there are no barriers in place to applying for this particular position. And then we're going to start reviewing those applications in May. And now, you know, if we haven't found the right composition, right, by these deadlines, we're certainly going to continue to look into this space, you know, kind of at the end of April, beginning of May. Hey, did we find that the humans we need to be the voices in this space? So we'll make sure that we are circling back there. As we know, sometimes these positions can seem daunting, but what we want to do with this role is to say, hey, this is a council where we need your voice, and you're welcome. And don't be scared. It's awesome, and you can do it. And so then we'll be reviewing those applications in May. And of course, the commissioner has to approve each appointment. So we will bring those recommendations then to Commissioner Smith. And she will review those applications, make those final decisions, notify the chairs, and we will have our new membership. From there, starting in July, we will have our membership onboarding process, which again can feel daunting. It's a lot of information, right? It's again a big task we have. And that's where all of us in council will come into play to make sure that we are assisting in that onboarding process, having the chairs, you know, open for questions, right? Hey, do you need a one-on-one? Do we need to talk through this? Just so that everyone who comes on really feels they have the support in place to do this work with the knowledge that they'll need to do it. Caitlin, did I miss anything in that?
Yep. Megan, thank you.
You're so welcome.
I did just want to, I'll go ahead and drop these in the chat as well. So it looks like we have 1, 2, 3, 4 seats that we're going to be actively recruiting for this season. We'll have, I believe, two seats for nonprofit healthcare facilities, 1 for the community mental health center that performs evaluations pursuant to Article 67, and then 1 for a member of an advocacy group for persons with disabilities. So again, I'm going to drop those in the chat as we have our famous Ryan Templeton on to provide us some legislative updates in just a moment. But I'll go ahead and drop that information in the chat that we'll be specifically looking for during this recruitment process. So as Megan stated, we're kind of in this recruitment preparation right now. I'm working with the communications team to develop some materials, to develop some language, and then we'll be sending all that information out to you all to, you know, send to your respective networks. We're going to be using social media. If there's some, you know, newsletter articles that you think that we should tap into, or any sort of community resource that we can tap into to start, you know, recruiting these specific seats, please go ahead and let us know, because we definitely need to work with you during this recruitment process to make sure we get the right people in place. And then, yes, as Megan said, we'll be accepting applications until the end of April. Excuse me, the mailman is here. Do you have a question?
Yeah, thank you, Caitlin. I had a question about the seat for one seat for community mental health center performing evaluations. I'm not sure where the board seat language lives, what authority, if that's statute is what I'm thinking versus rule, but I'm curious about that language because the kind of terminology of community mental health center is kind of, you know, phasing out in terms of comprehensive and essential safety net providers rather than community mental health centers, as well as the fact that you know, my kind of understanding historically of CYMHTA is that, you know, for many years, evaluation, that initial assessment lived kind of solely in that community mental health center network. And that's not the case now. We have quite a wide, I think I can speak for accurately for the other ASOs as well, not just for Signal that I work with directly, that our assessment networks are much wider in terms of not just being community mental health centers and also with that terminology going away. So kind of like dual pieces. I'm curious about the recruiting for that seat. And if there's, again, not knowing which authority the language lives in, I don't know if that language can actually be amended easily, and maybe it can't, but then how is that kind of operationalized in terms of recruitment?
Absolutely. So I'm looking at a board member list that was provided to me, and I believe that that language has actually already changed. So if we look in our bylaws under Article 2 membership, this is the statute that defines our membership requirements. And it looks like it is now one member representing a behavioral health safety net provider that performs evaluations. So that is the exact statute language that will be that person fulfilling that seat. So it's the statute is 27-67-1092 CRS. So that is the language that's used in statute right now. But with regards to, you know, actively recruiting for this, we definitely want your input and some of your guidance with this, because, you know, we can definitely tap into Art Network, but, you know, who you all would like to have serve within the seat and who you think might be the best candidate for this, and the different resources that we need to reach out to, the different networks we need to reach out to. So we're definitely going to, you know, be relying on you all to help us with that recruitment process for this seat as well. So any language that you might, you know, suggest for us to use, or again, you know, networks to reach out to, or newsletters to tap into, or anything that we can do to specifically recruit for these seats, please let us know.
Thanks, Caitlin. That's great. That's wonderful to hear that that language was updated. That kind of answers my question.
There you go. Perfect. So any other questions about recruitment, or kind of what's coming down the pipeline with regards to that? All right. So with that, moving back over to our agenda, we are going to turn it over to Ryan Templeton.
Well, good morning, board. My name is Ryan Templeton. I'm the Legislative and Governmental Affairs Division Director, also sometimes referred to as Policy and External Affairs Division Director. I love jumping onto an advisory board that is talking about where does statutory language come from, or where does language come from, and is it statutory? So love it. Kind of made my day so far today. So thank you for indulging me in that. So legislative update. We are in the thick of a legislative session right now that started on January 8th, goes for 120 days. The last day is May 7th. Yeah, not that I'm tracking that or anything, but there's a lot of stuff going on now. I will share the famous BHA bill dossier, which is the list of bills that have been introduced. A reminder that things that are shared within public meetings are yours to take. Right? You can use whatever you want with this. I usually get questions about, can I share this about? Hey, if it's shared in a public meeting, it is fully yours. That bill dossier gets updated. I think it's about 4 in the morning every day. So you have that information about these are introduced bills that BHA is following. I get a list and add, or my team gets a list and we add bills to that we think impact behavioral health. Not all of these bills impact the Behavioral Health Administration directly, but just bills that we think are of interest to behavioral health service delivery across the board. So I'll put that in now just so you folks can have it. With that, then I'll highlight a couple things. We are in a pretty massive budget year, right? So it's between 700 million and some times talking above $1 billion budget deficit that we have to make sure that we have a balanced budget every year as a constitutional requirement. So with that, it's a lot of cuts to programs and a lot of looking at efficiencies to be gained. The Joint Budget Committee is working hard through figure setting right now, based off of the hearings and the supplementals. They have to make that determination about how to get to a balanced budget and to a long bill and the long bill package that is due to the Senate on March 24th, which is a Monday. So even though there's a great bills that have been introduced that have appropriations, usually just have to wait, or have a require a level of funding, usually have to wait in appropriations until after the long bill is introduced and is moving along. At March 24th is that date that is the long bill is expected to be introduced in the Senate. So we're following that very, very closely, as the Joint Budget Committee has to make a whole lot of decisions about where to and how to fund services across state departments. A couple bill updates. Last week, we were in committee, we as in BHA were in committee to talk about Senate Bill 25042, which is the crisis response system recommendations. It passed committee unanimously, passed the Senate Health and Human Service Committee. It's going to appropriations this Friday, with the expectation that the amendments in Senate Health and Human Services will or should get that bill down to a no fiscal impact. So that's making updates, tracking what does our response system look like that includes co-responder and treatment in place, and our behavioral health crisis response system, how does that all fit together to make sure that we are addressing gaps and financial shortages. It's a little bit about reporting within there. So that's one that we are following very closely and actively involved in as well. One that we are incredibly excited about earlier this week, our Commissioner Jeanette R. Smith, testified in strong support of House Bill 251124, which is universal contracting provision requirements. That's BHA's one legislative agenda item. So that gets us to a spot where we're streamlining what are in universal contracting provisions. So right now there's 16 statutory requirements. This was part of when BHA was created, that one of the initiatives of BHA was to streamline what contracts across every state agency for behavioral health services look like. There's 16 provisions. Some of those provisions are regulatory. Some of those provisions are already in the general state contracting template. And we were able to, through 18 months of working with state agencies, providers, individuals with lived experience, family members, come up with actually there's 4 true provisions, which is standardizing data collection and reporting, making sure that all programs across Colorado are connected to our larger behavioral health system that BHA is responsible for, making sure that all programs submit grievances or complaints into our system-wide grievance system or statewide grievance system, and then making sure that there's consistency in enforcing contracts across state agencies, right? So if there's an entity not following contractual requirements, we want to make sure that a state agency talks to another state agency so we can all be in alignment to make sure that we're supporting providers and ultimately the people that receive services, to make sure that they get access to quality service delivery. So that passed committee. It does not have a fiscal note attached to it, so I think it is up for seconds in the House today. Another one, Megan, I see your hand. I will kick it to you if you have a question.
Thanks, Ryan. The universal contracting, tell me more about the data sharing piece. Does that mean that we're going to have more access to data across systems, which has been a bit of an issue in some places as of late? Is that going to kind of rectify that piece?
So not fully rectify that through universal contracting provisions. It's more of when we as a state or different state departments are contracting for services that require data, it's creating consistency in what that data looks like, right? So if we're asking for demographic information, for instance, let's let's ask for the same demographic information so then we can compare the same thing across the whole bunch of different programs. So ideally, we get to the spot where there's data interoperability and integration. That isn't necessarily this specifically, it's one piece to that. We aren't setting up that every program has to submit data specifically like that, because as we know, depending on where the grant comes from or where the program comes from, they may have individual reporting requirements, but we want to try to create truly it's a simplified way so providers don't have to say, oh no, I have to report this kind of data for this program, this kind of data for this program. If we can try to start creating a level of consistency across that, that's what we're trying to go for here, which ultimately hopefully does lead to more consistent data reporting, which then we can utilize better to improve access to service delivery.
Thank you. And that data will be housed in the Performance Hub, or like where do we go to access that data as we begin to streamline it and make it more available?
Yep. So universal contracting provisions are there for every state department that funds or administers programs for behavioral health safety net services. So BHA's data and all of those programs are housed in our lake house that then gets external facing through our Performance Hub. Yes, it is not necessarily the case that every other state agency's data for their programs would be housed there. There's a larger data approach to how do we make that more consistent across state agencies, but that's not necessarily this UCP specifically, but a larger data interoperability platform projects across a whole bunch of different state agencies, including the Health Information Exchange folks as well, and Office of eHealth Innovation.
Thank you.
Another one to keep an eye on within this group is maybe House Bill 251160. That's the mental health prevention pilot program. It essentially creates a one-year pilot program that is really looking to create a tool for kids in schools. The bill, or as introduced, it was something along the lines of serving 42,000 kids with a tool for an online chat, as well as access to Colorado licensed behavioral health professionals. So we're following that one very closely because it looks like, or it feels like there's some similarities across other things that we at BHA and the system is responsible, like iMatter, or one of the safety net services is screening, assessment, and treatment. So we're watching that closely to see where that one lands as well. Dr. Klott.
Hi, thank you. I've been curious to know more about this bill, and maybe not necessarily the topic or need to discuss in this space, but I'm not familiar with what program is going to be used or what the evidence behind it might be for this, which in many ways does sound great, but just curious if you have any inside scoop on that at all.
We do not have an inside scoop on that. It's the one where this bill essentially says, hey, BHA, enter into a contract with a third party to administer this thing. So we're assuming we would, if this bill were to pass, go down a fully competitive procurement, which I'm assuming there's someone behind this saying, we do this now. We don't have clear lines into who that would be, as this bill was not ran through us either. So it's kind of doing the around game for us, being like, well, wait, there seems like some similarities, but what are we actually trying to do with this bill, and how does it actually connect with our larger system that we're trying to create? One thing that BHA is really trying to focus on is not creating individual one-off programs that have created our patchwork of a behavioral health system over the years, right? I think a lot of the folks on here are very familiar with where we have been and where we have gone to over the last 2.5, 3 years of BHA. Our behavioral health system was created by a whole bunch of different programs that do similar things kind of in a uniform fashion, but BHA was created to get those things working together and create a true behavioral health system. So there's not a kids programs over here, some adult programs over here, some SUD specific over here, some mental health specific over here, and then we throw crisis right on the top of all of it and try to get that together. PHA was created to try to expand that, to get that cohesive. So programs like this that we see, it really raises an eyebrow for us with the wait, how are we making sure that this fits into what we're trying to accomplish? So Dr. Claude, I appreciate your question about that and how we'd implement this. It would be a competitive RFP as that's how it is spelled out with the introduced version of the bill.
Thank you.
Megan.
Thanks. I had a similar question, Dr. Claude, and I wonder if, like, who's leading the bill? And do you reckon that there's like already an idea of this sort of not named program thing that is sort of like what is hoping to come out of that? Have they communicated that with you, I guess, since you're named in doing the thing? And also the fiscal note it's not like huge by normal standards, but I feel like it's huge by this legislative session. So does this mean that the bill will go to sleep with all the other bills and appropriations that have large fiscal notes, or are we hoping that it does go through? I just wonder what the end goal is with that one.
Yeah, I mean, Megan, yes, it's a $1.45 million published fiscal note there. So yes, it will sit in appropriations. There is the other side of this is that, yeah, I mean, we are working with the sponsors to try to get to the, hey, where is this coming from? And is there an opportunity for other programs to actually take on this responsibility? It's from Michelson Janae. So very familiar with the behavioral health system over the years as now Senator Michelson Janae, representative for quite a while as well. So very familiar with her and working through this. Yeah, and then it's Reps Garcia Zander and Lukens in the House as well. So yeah, but Megan, you're right on. It's likely going to sit in appropriations for a long time if it does pass committee. It was pulled on this week. It was originally scheduled to be in committee this week, but so there is some back and forth with sponsors about how to get to a spot that things could move forward or ensure that the intent behind the legislation is being met for kids in schools, as I think is another opportunity there. As right, we have the 12th through 6th or the 6th through 12th grade mental health screening program from a couple years ago that has off to a slow start. I think it's only in 8 schools so far this year, but that's another program that's very similar to this, providing screenings and some sort of service delivery to identify needs within for kids within schools. So that's what we are actively working on with the sponsors to say how can those programs potentially do that too. And Jerica 241406 covers that as well. So right on. There's a lot of different things. So want to make sure that we are being thoughtful, especially in an incredibly tight budget year, to get to a spot of making sure that programs fit together nicely. That's all I had for you. I did put that bill dossier link in there. Like I said, it gets updated bright and early every day. I suppose it's before it's bright every day. So that is yours. Whatever you want to do with it. Megan, I see your hand.
One more question. I'm sorry. Every time I get you, Ryan, I'm just like, we should just have like one-on-ones, like once every couple weeks. Sorry about my voice. I'm sick. 40 Senate Bill 42. The money goes to Department of Public Safety. Tell me more about housing the funds in that, unless they've switched that out.
So there was 2 amendments in the Senate for that piece of legislation. So it essentially, the public safeties section 1 of that bill was they were having money to do stakeholdering for identifying gaps within the crisis response system that public safety predominantly does. Co-responders think, right, as well as some parts of treatment in place stuff like think James McLaughlin and the UPass Regional Transportation District, right? Some things like that. So they're doing that. One of the amendments in committee last week was to have that be virtual. And so then based on the stakeholdering being virtual was the idea that fiscal response would go away. The other side to that, in the initial fiscal note, there's $550,000 for Medicaid to do a study on the behavioral health crisis response system. There's an amendment to change that to BHA. The Behavioral Health Administration is responsible for the behavioral health crisis response system. And we have BOSOs coming in place, so that are also statutorily required to do this exact same thing on a year-by-year basis based on the, if you had this on your bingo card, 2750-301, subpart 3B, that requires a gap analysis for the whole system that includes emergency and crisis behavioral support. So with that, depending on timelines, we will be doing that as it was amended in the Senate. And if we can do that a year out from what is currently in there now as a January 1 of 2026 requirement to have all the gaps, if we can move that out a year, we can have our BOSOs fully up and board and doing that and provide that report within existing appropriations to get the bill to a zero fiscal impact. A lot of information there, and I talk really fast, and I see the ALS interpreter going, slow down, buddy.
For those updates, that's what I wanted to hear.
Yep, that's what I had for today. Thanks for the opportunity. Please do not hesitate to reach out. You can reach out to Caitlin as well. Caitlin is on my team and is fantastic at staying in contact with me. So if questions arise, I'm here for all of you as well. So thank you for your participation in an advisory board. Very important to make sure that we utilize your expertise to drive quality access for the people of Colorado. I'll kick it back to you.
Thank you so much, Ryan. We really appreciate you being here today. Any last minute questions for Ryan before we let him go? And again, if you need anything, if you ever need to reach out to Ryan or anything like that, feel free to reach out to me. I'll be happy to provide you with his email, or I can, again, relay your questions or anything like that to him. So thanks so much, Ryan. We really appreciate you being here. All right. And with that, we are actually going to pass it over to Meredith Pillars to provide us some updates with regards to rules.
Yes, thank you. And if I knew Ryan was there, I should have just had him do it because he is also the rule guru. Thank you everyone for letting me come and join your guys' board meeting. I am Meredith Pillars. I am the Independent Assessment Program Manager with the Behavioral Health Administration. I am on the Children, Youth, and Families team with Lindsay. She is one of my teammates. So unfortunately, she is out sick, and I saw her yesterday, and I'm glad she took today off because she did not look or could tell she was not feeling well. But unfortunately, she is the one who really is kind of the expert when we had planned for her to walk through what the rule changes were for CYMHTA, and then I was just going to talk about more of the process and kind of the other things that are in that rule packet. Since she's not here, I can tell you a little bit about the updates of CYMHTA, but I definitely am not quite as familiar with those. I'm going to drop, and I earlier, but I'm going to drop a couple links again into the chat. So this first one is, actually, sorry, I have too many things up. So we are, as many of you guys know, in the process of our rulemaking process for administrative, provider, and system or commissioner rule. So we are going through and doing 3 different rule volumes. A lot of the work that was done was during this fall. So that was kind of when we put out those initial drafts and went through and did the majority of our stakeholdering. And so what we're going to talk about today is the administrative rules. And what the administrative rules are is really kind of the rule volume that kind of determines how different programs and initiatives or services that BHA funds or oversees are really applied for and or accessed. So with CYMHTA, you'll see it used to be in our provider rule volume. And so one of the changes we made was moving it over to that administrative rule volume. We also in that rule volume, so there's a couple new things in there as well as just other stuff that got moved over. So we have in that our BOSSOs, on how to procure our BOSSOs and rules around that, which was already in there. We just made some changes to where they were located in the title, but no actual content changes. We also added, and these are fully new, the system of care rules for children and youth. And so those rules are those draft rules are really looking at kind of the eligibility criteria for children and youth who are going to access the system of care, as well as residential treatment, some additional training requirements for residential treatment providers. With those, as we've heard and we know, they are a very, very short rule volume. They came from House Bill 24-1038. And the reason why we have it being very kind of small right now and really focused on what was outlined in legislation is because there is a lot of work happening with the community at BHA and HCPF, as well as CDHS, to really design and create a system of care framework for the state. And we know that we need the community, we need to be building this thoughtfully. And so our plan is, as kind of these decisions are being made and as kind of the system of care is being developed, we are going to be going back in and updating our rules to reflect that work. So that way we aren't getting ahead. We're not dictating what the system of care looks like. Instead, we're really taking kind of what is being created and designed. We anticipate going back, at least for the next few years, probably every year, to be updating those rules. So that is something that will be continuously happening over the next few years at least. The other set is the CYMHTA rules. With those ones, so as I said, those we brought over from the provider rules, so they're in a different rule volume now. And it's mostly technical changes, so updating based on statute changes and citations, because we've updated our provider rules, as well as having this move into this rule volume. It creates a lot of different citations, which is one of those things that is not necessarily fun. And then the major content changes are what was recommended and voted for by the board. And so allowing, I think, just a couple of those changes are to allow that face-to-face interview using video technology unless it is clinically necessary or requested. So if at any point it's requested by a parent or caregiver that the assessor be physically in the same room, then the assessor would have to go in and honor that request, as well as if it is clinically indicated. And the reason for that is right now there is that waiver, but as we're seeing more and more of our clinicians kind of operating in that way, wanting that to have to be an option and have to do a waiver request every time. It also aligns with kind of how our other, so for our family first assessments, as well as we're looking at these enhanced standardized assessments through Medicaid, allowing the licensure candidates who are working under that supervision of that licensed mental health provider to conduct assessments. So the licensed mental health provider, the assessment is operating under their license. They have to sign off on every single assessment. So there is that oversight piece, but really trying to open up our network and allow individuals who are qualified to complete the assessments. And I will just say with that, I know from my own experience, I think that there's a lot of value and sometimes having licensure candidates actually can be better than licensed mental health providers, which I know sounds weird, but there's a lot more oversight. You're getting regular supervision, consultation, and really able to engage and work with your supervisor as well as usually your team, where once you are licensed, a lot of that falls off. And so you aren't required to have kind of that regular consultation. You should ethically, but it's not that mandated, and there's a lot less oversight. And so, you know, in my experience, I have seen at times where licensure candidates can be better mental health providers than us who are fully licensed. Other one is really looking at those timelines, so moving it, so urgent, instead of it being 24 hours, having that be 3 days, and then the standard timeline being 10 business days, and allowing for up to 2 5-day extensions, but limiting it to 20 days. And the 10 business days is also really aligns with our other assessments. So for Family First, that is a 10 business days. So for our counties, as well as we are with that enhanced standardized assessment as well. That is also that 10 business days through Medicaid. So wanting to align those. Megan, I saw your question in there. I don't believe, so there is a ratio in statute. I will say it's really that hours. So you are required to have 90 hours of individual supervision. Half of that has to be one-on-one. I will say typically, I mean, when I provide supervision, my own experience, I think at most I've had 3 licensure candidates working under me. And then I know community mental health centers, in my experience kind of working in those fields, there's usually about 3 to 4, maybe 5 clinicians on a team working under the supervisor. But because it tends to be an hour weekly of that individual supervision, it does keep it lower. And then there is ability to do group supervision. And I don't know off the top of my head what those standards are, what that ratio is, but not all the hours can be done under group supervision. So only half of those hours. So typically, I think from what I've seen, and this is completely anecdotal and just my own experience working in the field, it's been on that lower end. So about 5 or so per supervisor, especially, and this may have changed, but I know when I was in the field, there was a requirement that had changed through Medicaid that the supervisor had to sign off on every single clinical note done by the licensure candidate. So it was that they had to sign off on a certain many every month, and then they also are required to sign off on every single diagnostic assessment. So there is also that oversight as well. And then there's an up to the parental fee adjustment, just so that it directly references ability to pay, which allows the income and assets of a legally responsible person to be considered in the parental fee adjustment. I wish I could tell you more about that, but I think you guys probably all know what that means much better than I do. And then it also allows for appeal interviews to be conducted remotely if they're, and accounts for the fact that there may not be a mental health treatment provider available within 24 hours of a decision. So in that case, the appeals reviewer must recommend appropriate alternatives. Yes. Oh, thank you, Brett. And so those are kind of the big content changes. And then for CYMHTA, and then the rest are really, as I said, those just technical changes. So kind of moving the location and then updating a lot of those citations and definitions. The other thing in that rule volume, you will see let me pull it up. We also moved over, so the addiction counselor certification and licensure requirements, those were also in provider rules, and that whole section from provider rules just got moved over to administrative rules. There was no changes whatsoever. It was just a copy and paste from that section. So that way it's in the correct rule volume section. We are going to, for feedback, we have a couple ways. We have this feedback form, it's say 2024. This is the one that we use for all of our rules, but we're going to use it for this one as well. And I can post this maybe in the agenda. I don't know how if it will work, but we are having 2 stakeholder session on February 19th from 4 to 5 and February 20th from 10:30 to 11:30 in order to kind of walk through these rules and really go over the CYMHTA ones. And I think briefly just kind of review all the other changes. And so please, if you're able to come, please do. And if you're not, and have feedback, we have that form. You can also reach out to Lindsay, or I will put my email address in the chat as well with feedback that we will collect, review, and respond to all feedback and make changes as necessary or appropriate, kind of those, the rules that we are proposing. Questions about those? Sorry, that was a lot of information really quick. Okay. I see Megan and Brett. I'm not used to Zoom.
You're first, Brett.
Oh no, I don't want to jump the line. I think you were first in line.
Sure, I'll go. I have two questions. Thank you. My first one is the Provider Training Academy, and those stakeholder sessions were done separately. And it was very interesting to attend those because there were no parent voices or youth voices in that conversation. And while it's for providers, really what we heard, and I realized this was a separate process from you, Meredith, and done in CDHS. But what we heard was just like providers really kind of saying like, don't give me any more regs, right? Like I'm already overwhelmed. Like I already feel like I'm doing so much. And now y'all are going to give us some more to do. And so it really felt like those sessions were like, let's cut everything out. And yes, our providers are doing so much hard work. And I'm so grateful for them. Also, if we take everything out, we're not in compliance with statute, number one. And then number two, what does happen if we kind of gut the intention of Provider Training Academy, right? And then all those providers who are like, hey, I got my training, like I'm so good, didn't actually get the training that was required in statute around trauma-informed, especially when it comes to the opening up that CHIRP waiver and knowing that so many of those young people are co-occurring with disabilities. As we open that up, we're going to see a lot more co-occurring with disabilities. And why would we not have very specifically neuroscience-based training around neurodivergence, right? Which is oftentimes what you all see when you have a co-occurring kiddo, right? Sometimes hard to diagnose or hard to treat. Also kiddos with disabilities that maybe have physical as well as mental disabilities in residential environments. And so these are missing from that rule volume. And it must be frustrating for you, Meredith, because it happens completely separately from your purview. However, it would be remiss not to name and add specific trainings in that space. And I would also say for the CANs as well, if we don't have parent and family caregiver voice in those meetings in a meaningful way, it still creates a barrier to access care. And also a frustration for providers, right? If providers are going through all of this training and then still not able to meet the needs of the young people they care so much about. So just a couple things there, Meredith. Thank you.
No, thank you. And I really appreciate that. And I know Pam as well has kind of that provider perspective. And so I really kind of appreciate hearing that in all those perspectives. And I will take that back as well to, as you said, to DCW and HICPUF, as they are the ones that are leading it, and to make sure that they're aware of your feedback and, able to work with you guys, with families, because yeah, we want to make sure that there is all of that voice. And I'm happy to take that feedback to them and kind of talk through it with them. Unfortunately, as you said, it's not my purview scope. I don't have any power in general, but especially when it does come to what DCW and HIPF is doing, but I'm happy to at least bring that feedback to them and let them know kind of that concern and see if there are any other opportunities for feedback from parents, families, youth, those with lived experience, as that's really important for us to hear.
I had just wanted to share my experience, Signal's experience over the past couple of years related to some of the specific rule change proposals for CYMHTA that Meredith was talking about. So for the parental fee piece, the way that the language in rule is written now, it outlines specific elements that the CYMHTA program. So right now, the kind of ASOs and future state, the BASOs, in collaboration with the BHA, it indicates criteria that we'd be allowed to consider in requesting a reduction of a parental fee for a family receiving CYMHTA services. There's some really great elements that we're allowed to consider, such as outstanding medical bills or educational costs, to say like, hey, there's some financial considerations here that are impacting the family's ability to pay. Can we reduce the parental fee lower than the standard 7% that would be required? The thing that's missing that this requested rule change would add is the ability for us to consider the family's ability to pay. So right now we could have a family, maybe it's a single parent, maybe they're very low income, but not quite low enough income to receive Medicaid, which is why they're accessing CYMHTA to support in the behavioral health treatment costs, but maybe they don't have educational costs and they don't have outstanding medical bills. But we know that they don't have the ability to pay because we know what the financial income of that family looks like. We can't use that to justify doing a parental fee reduction. So we felt very strongly when these suggestions were being discussed by the board back in 2022, of which I was attending, but I want to be clear, I wasn't a member of the board, but just attending from the perspective of an ASO delivering this program and work. Just felt that we were really missing the ability to understand a piece of financial situation for some of our families, and that there was a barrier to being able to reduce the parental fee at times when we might need to. So I just wanted to share that on the parental fee piece. And then on the assessment related components that Meredith was also sharing, Signal has been operating, as Meredith mentioned, under a waiver to be able to use telehealth for assessments and to be able to use licensure candidate level clinicians for assessments over the past fiscal year as well. And have also been using licensure candidates in other assessment spaces as she shared. So I just wanted to share our kind of experience with that. We've found it really helpful to families to be able to have those options. And the telehealth piece, it really allows us to have a network perspective where we can, because we have a very big area in Colorado where regionally people may have access to more services or less services, you know, in a regional basis. And so having the option to provide telehealth has been really helpful because we may not have somebody physically located with a particular specialty that we know that child has. So maybe there's one of our assessment clinicians has some additional qualifications or subject matter expertise in working with individuals who have co-occurring diagnosis with mental health and with intellectual developmental needs. And if that person's not like physically located in the region of that family, we wouldn't be able to match them to complete the assessment. But if telehealth is an option, and if the family would like to access telehealth, then we can do some better kind of matching between folks. We also, you know, have a lot of families who are just really, really busy and are really in a state of personal crisis when they call to access a CYMHTA assessment, and hearing that they need to like get their kid in person with someone in the midst of work schedules and schools and all these other things just feels like one more piece that is really hard for some families. And so some folks really benefit from the option of having telehealth. We've also, part of our waiver is, as I think it matches what's proposed for rule, but Meredith can correct me on that there still needs to be option and capacity to offer in-person assessment. And we do have families that take that up as well. So we do have folks that would like to receive an in-person assessment. And honor that and make sure that we, have clinicians in our network when we're adding people to our network. It's one of the questions we talk to them about. Some of this will happen via telehealth, but what's your office space? Where are you located? Can you, accommodate in-person assessments, those types of things. And then last thing I'll say, and I'm sorry that I am talking so much. I think I've just talked for 5 minutes straight, so sorry about that. But with the licensure candidate piece, I really, my experience has really matched with what Meredith has said, that actually some of our strongest assessments can come out of working with folks who are, they're postmasters, they've received the education, they have that direct supervision, but they may not have the full independent license yet. And it's almost in some ways like getting two clinicians for the price of one when you have that candidate completing an assessment, because their assessment has to be reviewed and co-signed by their supervisor. They're getting that active clinical supervision. And so for the network of assessment providers that Signal works with, we have some really great clinical work being done by candidate level staff. I'd say we probably just kind of currently what our landscape looks like. We probably have about 2/3 of our assessment network that is fully licensed, independently licensed with that LPC or LCSW, licensed professional candidate or licensed clinical social worker type credential. And probably, these are very rough numbers, but probably have about 1/3 of that network that are candidates that are working with those fully licensed individuals. And so usually the fully licensed folks also know the intimacies of this assessment processes, the intimacies of using the CAMs, like all of those types of things. So we found it to be really helpful for having an expanded network that allows us to be really timely in meeting assessment needs, so that we're able to open up that quick access to care. So from our part of like how we've seen it play out and actually doing the work and what these changes would look like, we found it to be really positive.
Thank you. Yeah, thank you for that.
I just want to be mindful of time. We only have 2 minutes left, and we do need to move on to public comment.
I give one last.
Okay, if you just share your email in the chat for any follow-ups.
Yeah, can I just share one last thing really quick? Sorry. So just everyone to know, we are moving forward with our first read is going to State Board of Human Services, going to be May 9th, I believe. And then ideally our second read right now, how we have it scheduled is June. And then hopefully the rules will be adopted and go into effect by mid-July. So just kind of next steps for that process. And yeah, Mel, reach out if you have any other questions. Thank you.
Thanks so much, Meredith. We really appreciate you being here today.
Yes.
All right. So at this time, we are going to open up the floor for any public comments. So any member of the public that would like to come off mute, ask any questions, make any statements at this time. All right. And with that, it looks like we have officially done our first meeting of the year. So thank you so much for everybody being here today. Can I go ahead and get a motion and a second to end the meeting?
Motion to adjourn the meeting.
Thank you, Anastasia.
Second.
Who was that? Sorry.
Megan.
Megan. Thanks, Megan. All right, everybody. Thank you so much for being here today and being in attendance and for the wonderful conversations. And congratulations again to Anastasia and Brett for your elections as officers. If you need anything else in the meantime, please don't hesitate to reach out. But I will be sending up a follow-up email with a copy of the bylaws and the e-vote, as well as everything hyperlinked within the agenda. And then a reminder about the vacant seats open and some recruitment activities. So everybody just kind of keep an eye out on your email, because all that stuff's going to be coming to you over the next couple of weeks.
Thank
Okay,
you.
everybody.
Reminder, I may or may not attend the next meeting. I will be very, very early in my maternity leave.
Absolutely not a problem, Anastasia. That's why we have Brett. So
Exactly.
all right.
Brett, I'll let you know.
We don't talk
Thank
to you
you.
in bed.
Great.
Bye-bye,
Bye-bye.
everybody. Thanks so much. Have a great afternoon.